this panel's on trends in NTDs and philanthropy, and I thought what I'd start off with is talk about two sort of 50,000-foot global trends that I'm seeing in global health and development. And they come, the same trend is coming from two very unlikely places. One is the World Bank and the other is the Vatican. And the Pope has certainly actually prioritized us addressing poverty in this day and age. And similarly, Jim Kim from the World Bank has actually said, we're going to focus on socioeconomic development, but prioritize the poorest 40% of people in the world. So what we are seeing globally is that we're seeing tremendous development. There's good socioeconomic growth despite recessions. Per capita GDP is improving in countries. So we're seeing this trend. But what's within that is we're seeing a widening inequalities, or in economics terms, the Gini coefficient is increasing. I come from South Africa, and it's in the top 15 countries of widest inequalities, quite a few in Latin America. So we're seeing wealth concentration at the top. And so with what Jim Kim is talking about and what the Pope is talking about, this is what is at the heart of the response to neglected tropical diseases. Because we're not dealing with people in Johannesburg or Kampala or Nairobi. We're dealing with people out in very rural and remote parts of the country, people in communities where there's still barter trade. They don't have currency. So these are the demographic that Julie talked about, the poorest 1.5 billion people living on less than $1.25 a day. And it's not just neglected tropical diseases that affect them. They don't have access to proper nutrition, immunizations, water and sanitation, micronutrients and protein. But what we feel is that in responding to neglected tropical diseases, for which we have proven interventions, we actually change their baseline state of health, which allows them to take advantage of other interventions. So for example, if we provide the best food for people, but the worms are eating food, they're not going to benefit from the food. If we provide the best education, laptop computers and PhD level teachers, but children aren't going to school, which we know happens when children have worms, well, they're not going to benefit from that. Even if they make it to school, they won't be able to concentrate on their lessons. And we found that deworming increases school attendance as well as cognition among children. There's actually a percentage increase in IQ points as a consequence of deworming. A study that came out of Kenya showed that over 20 years, those adults who were more economically productive were actually dewormed as children. And so on a broader level, we feel that NTDs, or the response to NTDs, is part of, is an entry-level intervention upon which all the Millennium Development Goals and what comes afterwards will actually depend. So it's a very cross-cutting type of intervention. One more thing I did want to also mention on a global trend is that the world of scientific interventions has been very divided. And you think about HIV, there was the battle whether it should be prevention or treatment. And then we realized after 10 years, oh, we have to do both. And similarly, with NTDs, there is a bit of a dichotomy between research and development and programs. And what we do know is that even if you have interventions now, like diabetes and hypercholesterol, in time to come, you're going to need new drugs and new tools. So we always have to keep a healthy pipeline of research and development, as well as make sure that we use the tools that we have. And my colleague Michelle will talk more about research and development. So coming to the panel, if I haven't taken up all my time, what are the unique things that the philanthropic sector brings to the response to NTDs? Firstly, these communities don't even have a voice in their own countries. They're not a politically active constituency, and so they are literally voiceless. But it would be the usual suspect of people like myself speaking about this issue, because I'm a doctor. But when we have non-traditional speakers speaking out on an issue, that's when we get greater attention. When we have a corporate CEO speaking about poverty or about health programs, that's when it actually gets the attention of policymakers. And this is something very important that the private sector can do. I point to my colleague from the End Fund, who on their board actually has a banker And when he speaks eloquently about this, it certainly gets the attention of other people. So I think it's very important to think about the voice of the private sector and philanthropic sector in lending might to this cause. The second thing is the philanthropic sector has a lot of networks into the private sector. And this is what I feel is the fertile ground for innovation. Very often when I speak to donors, I don't ask for a check and then walk away, sign me a check and walk away. I want the donor to come with me on a journey, because we have a particular lens as physicians, as scientists, the way we look at the world. But the way the corporate sector actually looks at the world is a bit different, and they may find different solutions to the problem. And we certainly have seen this in the form of mHealth, which has brought a lot of new technology applications to monitoring, evaluation, and mapping, and reporting. So it's those sorts of innovations that we have to actually bring to the table. Just a little anecdotal story. I worked at a hospital where the superintendent was a doctor, and some of us know that doctors may be logistically challenged. But when they brought in an economist to run the hospital, it was for the first time that the hospital started making a profit. And I think that's the important thing, to think about the health response in terms of competencies and products beyond medicine and nursing. And when we start doing that, we bring innovative new tools that make the response or allow doctors to do and drugs to work better than they normally would. So I think that's an interesting approach to look at. The third thing is the nimbleness of the private sector and the philanthropic sector. We understand that governments have to respond to many constituencies. They have to get buy-in. They have a large, cumbersome bureaucratic process at times. But the private sector is much more nimble than the philanthropic sector. And so in supporting programs that are innovative, that have new approaches to development, that are pilot programs, those are the types of things that we need in order to show success and then take to the public sector for broader scale-up. Similarly, we found that the private sector was very well positioned to actually close the gap on funding that the public sector couldn't do, for many a time for political reasons. For example, there was a case where there was unrest in a country and bilateral support was actually halted. And we had the VN Fund actually step in to close the gap or provide bridge funding until the unrest had settled. And programs actually continued in that time. And then the last element that the philanthropic sector brings is, and I'm going to say, financial instruments or products. And I think we're starting to see a trend with social impact bonds, etc., in other sectors. I think microfinance was a huge development, positive impact that it had. But we need to see new financial and innovative tools. So why is NTDs so appealing for the philanthropic sector? Well, firstly, as Julie mentioned, all the drugs are donated. So this is about a public-private partnership where you have governments that are formulating policies, you have the scientific community that has a strong evidence base upon which it bases its interventions, you have the private sector donating the drugs, you have the NGOs working hand-in-hand with local communities. So it's a multi-sectoral response. But here's the really cool thing that happens. It's an inbuilt governance mechanism. Because traditionally, all these sectors never work together, and they don't trust each other. And that's a good thing, because each is looking out for the other. And as a consequence, we're getting good governance, high levels of accountability and transparency. The other nice thing is that there aren't too many other indications for these drugs, so it's not like they can develop a parallel market. So it's a very efficient program. The second thing that happens, and Julie touched on this regarding efficiency, but I think we often hear the term economies of scale, and what happens is when you increase the numbers, your unit cost comes down. But what the NTD program has is it has economies of scope or specialization. If you apply the same system for many diseases, you're reducing the unit cost for each disease, and you reduce the overall unit cost. And the NTD program definitely has this since we moved to the integrated platform. I think the other thing that is really, really nice about this is that there's an elimination potential. And many scientists will deliberate the merits of elimination, eradication, termination, annihilation, extinction. But what we're talking about is a huge public health problem which we're going to reduce or eliminate as a public health problem. On the last tail or the last inch of the response, well, we'll need to figure out a new response. But let's get there where the general population is not affected by these diseases, and then figure out the strategy on how to actually close that gap. And then my final point is on system strengthening and sustainability. And many of you have heard this term health system strengthening. If you talk about any particular disease, the conversation always reverts to, well, we have to strengthen health systems. Now, when you look at health systems, the way they're designed is they start off with the tertiary hospital at a capital city, then they move to secondary level centers, primary care level centers, mobile units, community programs. But we never get down to the elusive last mile. The trickle-down effect just doesn't happen too often. The nice thing about NTDs is it starts off at the last mile. It's not dependent on big hospitals. It's door-to-door, house-to-house, and school-based programs. So I like to say this is building the health system from the bottom up, and certainly building armies of community health workers. And then the final point on sustainability. This is something we all look to when we're supporting programs. And I don't know if a village needs a well, needs a water purifier, or needs a pipeline to bring in water. I don't know if kids need to become doctors, lawyers, engineers, or teachers. But I think what we're affording people when we give them NTD programs is that opportunity for self-determination. If we get them healthy enough to go to school and adults to be productive in the workplace, they will determine their own solutions and become part of their own sustainability. And that's what influencing the baseline health level is about. So I thank you for your attention.